Hello, my name is Dr. Joseph McHale, and on behalf of the American Society of Hematology Committee on Communications, I am here to provide some helpful tips for presenting at international meetings, specifically those where simultaneous interpretation is used. Although it might seem challenging to give a talk and connect with your audience when presenting through an interpreter, it is very feasible. It does, however, take an adjustment from your usual presentation style, both in the slides that you use and in the way that you present them. Over the next few minutes, I'll offer some important guidance on how to prepare for your talk and deliver a quality presentation. Here are 6 key points to remember. Follow the 1/3 rule. This means slowing your pace of speech by at least 1/3 and reducing your slides by that same amount. You should expect no more than 1 slide per minute. This will allow the audience to easily understand the information presented. Strategic pauses will also help the interpreter keep up with you and communicate your message to the audience more succinctly. Submit your slides to Ash by the deadline you are given, as Ash will share the slides with the interpreter in advance so that he or she can become familiar with your presentation. The better the interpreter understands your material, the more concisely he or she will be able to communicate to the audience in real time. Connect with the interpreter. Meeting with the interpreter before your talk will allow time for questions about your slides and discussion of any key points you may wish to emphasize. You can also agree on a system to communicate during your talk, whereby a simple thumbs up or thumbs down from the interpreter may suggest that you're on the right track or maybe need to slow down. Finally, meeting with your interpreter after your talk is a valuable opportunity to get feedback for your next international presentation. Explain acronyms. The use of acronyms is both natural and appropriate in medicine, especially for complex terms and chemotherapy regimens. It's okay to use them if they're essential, but make sure you explain what they're referring to. And keep in mind that acronyms may be different in other languages. Avoid slang, idioms, and humor. These types of things tend not to translate well, and it's possible that the intended meaning will be lost. Although you might be tempted to throw in a spontaneous joke or go off topic during your presentation, avoid the urge, as the information will likely be delivered much too quickly for the audience to comprehend. Practice. It is an adjustment to speak more slowly, use fewer slides, and relate to an audience that is mostly listening to someone else. Please make sure you can stick to your time and enunciate clearly to make it easier for the audience and interpreter to follow your every word. Here's an example of what your talk might sound like when presenting to a native English audience.
So there's a couple of ways of thinking about T-cell lymphoma, I think, in a simple way, and one of them I think about is CHOP-based chemotherapy appropriate? You can kind of divide the T-cell lymphomas into always, sometimes, or never.
And here's an example of a talk adapted for an international audience.
So the learning objectives for this talk are, first, to discuss the workup of qualitative platelet disorders, to recognize new diagnostic tools for von Willebrand disease, to describe potential sequelae associated with joint replacement in hemophilia patients and how to treat these patients.
Can you tell the difference? And there you have it. 6 simple tips for preparing and delivering a successful presentation at a meeting where simultaneous interpretation is used. Number 1, follow the 1/3 rule. Reduce your slides and slow your pace. Number 2, submit your slides by the deadline. Number 3, connect with your interpreter. Number 4, explain acronyms. Number 5, avoid slang, idioms, and humor. And number 6, practice, practice, practice. Thank you for watching. We look forward to seeing you and your great presentations at ASH meetings.